So neck trauma. So see, neck and retroperitoneal. We're talking about two important things: neck trauma and retroperitoneal trauma. They are divided into three zones. Actually, same neck also three zones, and retroperitoneal also is divided into three zones. What are the three zones? Just see here. In the neck, this suprasternal. From the suprasternal notch to below the cricoid cartilage. This is zone 1. Okay, from the suprasternal notch to the below the cricoid cartilage. This is zone 1. Zone 2 is
to mandible.
Cricoid cartilage to above the angle of mandible, and above it is zone 3. So here remember, zone 2 is the dangerous zone. If any injury is there which breaches the platysma here, there is a platysma muscle, isn't it? So any injury which breaches the platysma, you have to explore. In zone 2, any injury which breaches the platysma, you have to explore. Zone 1 and zone 2, zone 1 and zone 3 you can observe. But zone 2 you have to explore because there are major vessels here. Isn't it? Clear?
Yes.
Suprasternal notch, cricoid cartilage, angle of mandible. 3 parts you remember. 1, 2 and 3. In 2, it is a dangerous zone. So if any breach is there, you have to explore it. Okay?
Zone 1 means it's below the cricoid cartilage, sir.
Yeah, below the cricoid cartilage. Okay?
So what is for zone 3?
Above the angle of mandible.
To the base of the skull.
Zone 2, sir.
Zone 2 is in between. Below the mandible, above the cricoid cartilage. Okay?
Okay, sir.
Yeah, the major vessels will be lying here, right? Carotids, jugulars, everything will be lying here only. So any penetrating wound, we have to explore and we have to see whether there is any vascular damage or not. Okay?
Okay, sir.
Okay. So these questions are newer questions. Neck trauma and retroperitoneal trauma, they are in the newer textbooks. Okay, so pay attention to this. They will be asked. And in the same way, retroperitoneal trauma also, there are 3 zones. See here, zone 1, zone 2, and zone 3. Zone 1 is the great vessels, IVC, and the aorta. Zone 1. Zone 2 is the renal and ureter. Zone 2. Zone 3 is the pelvis. So maximum mortality is seen in which zone? Maximum mortality.
Zone 1.
Max mortality is zone 1. Very good. Okay. And emergency exploration is required for which zone?
2.
No, 1 only. IVC and aorta. If something is there, damage to zone 1, we have to emergency explore, right? You have to explore if there is any wound like blunt trauma, penetrating trauma to zone 1, you have to explore. Whereas in zone 2, only for penetrating trauma we have to explore. No need to explore blunt trauma if the patient is stable. Zone 2. Okay. Zone 3, pelvis. Only in expanding cases of hematoma only we have to explore. Expanding hematoma. That only we have to explore. Otherwise, no need to explore zone 3. Again, I'll telling once again. Just see. Zone 1 is the great vessels. Zone 2 is the kidney and the ureter. Zone 3 is the pelvis. Maximum mortality is associated with zone 1, point number 1. And point number 2, any injuries are to be explored here. Any injury to the zone 1 is to be explored here. 1. Zone 2, only penetrating wounds are to be explored. Penetrating wound to be explored. Other wounds no need. If the patient is stable, penetrating wound only is to be explored. And pelvis, if there is any expanding hematoma, that is, the blood vessel is there, any clot is there and the clot is expanding, then only we will go for surgery. Otherwise, no need. Is it clear?
Yes, sir.
Okay.